As osteopathic medical students become osteopathic physicians, they start to think differently. And a big part of that thinking is developing differential diagnoses. Doctors do need to think differently. They need to think broadly. And we want to train our physicians to have a systematic way of thinking, a process of looking at, finding symptoms, complaints, or problems in a patient, and thinking through them. So we give them a diagnostic method of looking at illness from a broad lens, and that's called the differential diagnosis, often called a DD, DDX, or just delta-delta. And there are 4 parts to acting with the differential diagnosis. When a patient comes to an osteopathic medical student or physician, the first thing they do is get information. And if they get a positive or an abnormal or something that they suspect may signify a problem, they have to gather information. And for every positive answer they get, they need 6 other questions to be answered. What is location, quality, quantity, aggravating and alleviating factors, and associated manifestations to that positive finding? They need to get information around that finding. And that's the first step in developing a differential diagnosis. Once they've got the information, they need to think of the possible conditions that could cause those symptoms. That's the second thing. The third thing is to prioritize that list. And once they've got that priorities, they move on to step 4, which is ruling out the conditions on that list. So how would this work in the real world? It's not just if somebody says they have chest pain, do they have something caught in their throat, do they have a muscle spasm, or are they having a heart attack? That's how we teach our physicians to worry about medical symptoms. But what is the differential diagnosis of a noise in the woods? If you're taking a hike and you hear a noise, the first thing you ask is, where did it come from? Was it far away from me or close to me? How much do I have to worry? What could it be? And if you're in the woods, the first thing you worry about is, what are the dangerous conditions? Could it be a bear or a snake? They sound very different, but they're all a noise in the woods. Most of the time, the noise is just a squirrel or a rabbit. Could be a deer. They all have a little bit different sound. But you always start with the most serious possible problem. You always worry about, is this something in the woods that could hurt me? It's the same thing in medicine. Is this symptom something that could hurt the patient? So we think broadly, and this helps our physicians avoid tunnel vision. It keeps them using deductive reasoning and thinking through a problem. And it, most importantly, helps prevent missing the most serious condition. So we want to keep our physicians thinking in possibilities, not probabilities. We want them to stay scared because lives really do depend on it. It may not always be a bear or a cancer, but if you don't think about it, you're not going to run and do what needs to be done as quickly as possible. That's what a differential diagnosis and how differential thinking works. Thank you.